My name is Kristie Kokeny, and I'm a physician assistant, and I've been in charge of the Prostate Cancer Clinic here at Urology Associates for the past 5 years. If you've been recommended by your provider to start a drug called Orgovyx, it is because it's a part of your prostate cancer treatment plan. It is a medication that is a form of hormone therapy or androgen deprivation therapy. So it's a medication that will temporarily suppress your testosterone, which we know is the fuel for prostate cancer cells. Orgovyx was FDA approved back in 2020, and we've used it at our practice for the past now 6 years to treat the disease. It is a pill, and a pill you take on a daily basis. First day only, it's a loading dose of 3 pills, and then it's just 1 pill every day moving forward until treatment completion. You can take it in the morning or the evening time, with or without food, whatever is easiest for you. You can take it with your other prescriptions. The most important thing is that you are consistent with the timing each day. I don't find that nighttime versus daytime administration procures any difference or variation in side effects. What I see and hear from patients are 5 more common side effects, with 2 at the forefront. 2 most common are going to be fatigue and hot flashes. Other 3 most common side effects are going to be mild weight gain, shouldn't be more than a few pounds, worsening muscle ache and joint pain, and then low libido. One of the side effects with Orgovyx you can't appreciate is the potential for bone loss. So just like us women, when we go through menopause, we lose our estrogen. Estrogen, testosterone, these hormones support our muscles that thereby protect our bones. While you're on the medication, you are increased risk for losing bone. We really care about protecting your bone. The last thing we want to do is, while we're treating your prostate cancer, cause you to have another problem. In order to combat the bone loss, we do recommend that you take supplements, calcium and vitamin D. And then for many patients, we will also recommend a baseline bone density test so we can see where your bone integrity is at the start of treatment, and that can be repeated every 2 years per insurance. Some patients are concerned about the possibility of becoming depressed, irritable, moody on the drug. What I can say is this: it doesn't usually tend to be an issue unless it was a problem going into treatment. It's something that we always want to know about if it's something that you are noticing about yourself or your partner is noticing, because there's lots of things we can do to help protect your mental health. It's important to us. Most patients, when they see me for their initial consultation, will begin the drug that day. Tony, who is a registered nurse, manages our pharmacy, and she pre-authorizes the medication, looks for financial assistance if applicable, and will have the drug ready at that appointment to begin. I generally see you in about a month for follow-up to make sure that you're tolerating the medication okay, and we review all the side effects and talk about ways we can ameliorate them if present. And in the meantime, patients have my number, or they can reach out directly if any concerns come up in the interim. By far, this is one of our best tolerated prostate cancer medications. Most patients don't feel that different than they did prior to treatment and are able to get through their treatment process with the support that we have provided for them here.